Hey, welcome back to SA Live from Travis Park to your home. We are right down here at the Buckhorn Saloon and Museum, and we love giving you good information to help take care of yourself as we approach the back end of the year. We want to talk about your back and the lower back because that's where a lot of stress gathers. I know with getting the Christmas lights down and possibly lifting the fork over the Thanksgiving weekend. It can be very stressful. If you're suffering from lower back pain, you're not the only one. The San Antonio Orthopedic Group is here to help us understand the signs. Dr. Neil Bhandari, a pain specialist, is with the San Antonio Orthopedic Group, and you've got a procedure that can help anyone, including me, that is having pain in the lower back.
Absolutely.
This is really simple and really fast.
Yep.
What is it called?
So it's called medial branch blocks.
But
the first step is to diagnose the problem.
Okay.
So lower back pain is usually caused by either a herniated disc or pain in the lower joints.
Okay.
So just like you have joints in your fingers, you have joints in the lower back, like right here you can see on the spine model. All these joints are called the facet joints. It lets your back bend backwards and flex forward and rotate side to side. So what happens with old age, you can get arthritis in these joints, and you can even have dysfunction of the joints if you get into like an accident.
Okay, so any kind of trauma to these joints
Absolutely.
can be chronic back pain. And obviously you know this because you have it.
Yes.
And you can't get relief. You can recommend rest and heat and exercise, but if you still have back problems, that's where the San Antonio Orthopedic Group comes in.
Yep.
This is a joint injection.
So sometimes it can be a joint injection. We can go directly into the joint and inject some steroids and local anesthesia, or we can get the nerves before they actually get into the joint.
Okay.
Yeah.
So when we're talking about movement of the spine, you're talking about bending and bending over, and obviously you know that it's, how long does this have to be going on before they need to come see you?
So it just depends on the severity of the pain. Some people just have a chronic dull ache that goes on for months and months and months, and if that's tolerable, that's fine. You know, you can do conservative things like do rest, heat, take some anti-inflammatories, Aleve, ibuprofen, things like that to help with the pain. But if it's something that doesn't really affects your life on a chronic basis, you want to get some treatment for that.
And that's where they need to go on
Absolutely.
and schedule a point to come see you and talk about it and figure out what the options are and let you diagnose it, because there are different alternatives.
Absolutely.
To fix it. We're talking about, you can use electric modules as well, right? Electronic shock.
So it's actually called radiofrequency ablation for these joints. And what we do is when you inject local anesthesia on the joints, it's very temporary. Just like when you go to the dentist, you get a local anesthetic. It doesn't last very long. It lasts a couple hours. Same thing with the joints. So the idea is we can do something called radiofrequency ablation of the nerves, and that actually damages the nerve just a little bit, so that prevents it from sending pain signals to the brain.
So the main thing that people need to understand is San Antonio Orthopedic Group, alternatives to pain. Which means you feel good, and that's what we're talking about. Do patients require anesthesia? They do.
So it depends on the patients. Anesthesia is not required. Most of these procedures are done under local anesthetic. They do require a fluoroscopy machine, which is an X-ray machine, so we know where the needles are going in real time. Okay. And sedation is optional based off the patients.
Well, you make this really easy to understand. Absolutely. So I would encourage people to have a conversation with you. Come find out. And if you know someone or you love someone that's having back pain, San Antonio Orthopedic Group, take them. Go ask questions. You can't ask a bad question, can you, Doc?
No, not at all.
That's the deal. 210-281-9595, TSAOG.com. We want you to feel better. We want you to have a great holiday season. If maybe you pulled something while you're driving or lifting boxes or this happens. It happens to everybody. Yeah.
Everyone gets back pain at some point in their life.
If you're a grandparent or you're just a hard-working man that's waiting for the UPS dude to show up with a box of Christmas gifts, you can have back pain. Thank you, doctor.
Absolutely.
You make this really easy to understand. Thanks. San Antonio Orthopedic Group, they have answers, especially with that joint injection. Ask them about that and tell them you saw it on SA Live. Coming up, we have a local country singer